everyone, and welcome to another ICD-10 CM guideline review, where today we're going to be looking at chapter-specific guideline 6, which is for the diseases of the nervous system, which is code range G00 through G99. So first we're going to look at the rules regarding dominant and non-dominant side. And this is for situations when your patient has paralysis. And so as it relates to the paralysis, the documentation in a lot of cases will identify if the affected side is the dominant side or the non-dominant side. However, should the side be documented, but the provider doesn't state dominant or non-dominant, and your coding manual doesn't provide a default, our coding guidelines actually have identified some rules for code selection. So if the patient is ambidextrous, the default is dominant. Ambidextrous means that they are left and right is their dominant side. Could be either or. If the left side is affected, the default is going to be non-dominant, and if the right side is affected, the default is dominant. Next up, we're going to look at a huge category for the nervous system, which are pain codes, which fall under category G89. First, let's take a look at some general coding information. Category G89, which is pain not elsewhere classifiable, can be used in conjunction with codes from other categories to provide more specific detail about acute or chronic pain, as well as situations when the patient has neoplasm-related pain. However, there are some exceptions. First exception, if the pain is not specified as acute or chronic or post-thoracotomy pain or post-procedural pain or neoplasm-related pain, we cannot use G89. Now, also a code from category G89 should not be assigned if the underlying diagnosis is known, unless the reason for the encounter is pain control or pain management and not the management of the underlying issue. And if you're like me, you're thinking, wow, these pain codes can actually be a pain. Another exception, when the admission or encounter is for a procedure aimed at treating the underlying condition, a code for the underlying condition should be sequenced as your principal diagnoses. And in this case, we're not going to use a code from G89. All right, speaking of sequencing, we're now going to look at listing category G89 as principal or first listed. So those situations are when the patient is coming in for pain control or pain management, and the reason for the encounter is that particular condition. That can be listed first. And then the underlying cause of the pain is going to be listed as an additional diagnosis if we know what that is. In those situations when the patient is admitted for insertion of a neural stimulator for pain control, the pain is going to be listed as principal or first listed. And principal is for inpatient settings, and first listed is when you're outpatient or coding for the provider. Now, when the admission or encounter is for a procedure that focuses on the underlying condition and the neural stimulator is inserted for pain control during that same admission, a code for the underlying condition should be assigned as principal, and then your pain code is going to be second. Next up, we're going to look at using G89 codes in conjunction with a site-specific pain code. So, first up, codes from category G89 may be used in conjunction with codes that identify the site of the pain. So, for example, I'm thinking of when a patient has low back pain, M54 M54.5, but it's chronic in nature, you can use both codes because the M54.5, the low back pain, shows specifically where that site of the pain is. Next up, in terms of sequencing our G89 codes with site-specific pain codes, we have a few rules to follow. Number one, if the encounter is for pain control or pain management, we're going to assign the code from category G89 followed by the specific site of pain. So another example could be a patient that has acute pain due to trauma, and maybe the pain is in the neck. And so you would use G89.11, which shows acute pain due to trauma. And then if the pain was in the neck, you can use M54.2, as that actually identifies the site of the pain. Lastly, if the encounter is for any other reason except pain control or pain management, and we don't have a related definitive diagnosis that's established by the provider, here we're going to assign the site-specific code first, followed by the G89 code. So very important to know how we should be sequencing our codes. Next up, we're going to look at postoperative pain. And one rule that I think is just very consistent throughout the guidelines is for situations when we're documenting or we're coding postoperative pain. The provider's documentation has to guide you in capturing codes for postoperative pain. Now, postoperative pain should not be assigned with a specific post-op complication. Also, post-op pain assigned with a specific post-operative complication can be found in Chapter 19. And in Chapter 19, those are codes for injury, poisoning, or certain other consequences of external causes. If appropriate, you can use a code from G89 to identify acute or chronic pain. Speaking of chronic pain is actually classified to subcategory G89.2. Per guidelines, there is no time frame in determining when pain becomes chronic pain, and you've guessed it, your provider should guide the use of these codes. Neoplasm related pain. We have code G89.3, which describes pain that is documented or related to or associated with cancer. Doesn't matter whether it's primary or secondary, or it could also be a tumor. This code is utilized regardless of whether or not the pain is acute or chronic. Now, the code G89.3 may be assigned as principal or first listed when the stated reason for the encounter is documented, we're back to this again, as pain control, pain management. And then the underlying neoplasm is going to be listed second. Now, when the reason for the admission and or encounter is for management of the neoplasm and the pain associated with the neoplasm is also documented, you're going to be using G89.3 as an additional diagnosis, and it's not necessary to report a code for the site of the pain. Last guideline, chronic pain syndrome. We have codes G89.0, which is central pain syndrome, and G89.4, which is chronic pain syndrome. These are different than the term chronic pain, and these codes should only be used when the provider has specifically documented these two conditions. All right, guys, that's all for our chapter-specific guidelines for Chapter 6, Diseases of the Nervous System. Thank you so much and have a great day.